Hello, I'm Christine Gatman. I use she, her pronouns, and I work on the Oregon Health Authority's accessibility team. I'm a white person with long dark hair. I'm wearing a green top, a black scarf, and red lipstick. The purpose of this training is to prepare you and help you feel more comfortable providing accessible vaccine opportunities. I will discuss how civil rights and accessibility are related and how being mindful about disability etiquette can build your understanding of equity. This training is intended to help you feel more prepared and comfortable in supporting people with disabilities and folks with access and functional needs. As defined by the Americans with Disabilities Act, or the ADA, an individual with a disability is a person who has a physical or mental impairment that substantially limits one or more major life activities that an average person can perform with little to no difficulty. Simply put, people with access and functional needs include individuals who need assistance due to any condition, whether it's permanent or temporary. There is no need to require that an individual have any kind of diagnosis or specific evaluation, or provide proof of disability in order to receive an accommodation. It's important to acknowledge the diversity that exists within our communities. People can have multiple identities that impact their experiences in different ways. Individuals with access and functional needs, including those with or without disabilities, can be accommodated in many ways. Accommodations can be actions, services, equipment, and modifications, including physical or architectural, programmatic, and communications modifications. With so many ways to provide meaningful and proactive accommodations, let's consider a few actions for you at your accessible event. If you are hosting a vaccine clinic that requires scheduling an appointment, you can offer multiple scheduling options. For example, online or by phone, even through email or text. It's a good idea to hold some spots for people to come without an appointment as well. You can arrange to have interpreters present at your event. This can be spoken language and ASL. You might train staff to be designated readers or to assist patients to fill out forms. Tangible items that can facilitate access and independence can include lightweight clipboards, various sizes of pens or pencils, and tables at various heights to support folks who are sitting and standing. Providing an accessible privacy room is another modification you could offer that could serve an array of individuals with or without disabilities. Being prepared to provide options is a mindful way to uphold the autonomy of your attendees. Some examples in a vaccine clinic could be choosing where on their body they receive their vaccine, the position of their chair, or the gender of their vaccinator, just to name a few. Some individuals with access and functional needs have legal protections, including but not limited to the right to be free from discrimination based on race, color, national origin, including limited English proficiency, sex, familial status, age, disability, and economic status. We can make our events welcoming by using signs and asking every person, regardless of disability, one important question. What support do you need to get your vaccine today? When interacting with folks, you can expect many different answers. Here are a few tips to be better prepared no matter what support people request. Be flexible, be creative, and above all, be respectful. Assume competence and independence. Speak in your natural tone of voice and treat adults as adults. Look at and speak directly to the person, not through their companion, caregiver, or interpreter. When meeting someone with a visual disability, identify yourself and others with you. For example, Jane is on my left and Jack is on my right. Speak in your natural volume and make sure your mouth is visible. No need to shout or raise your voice at a person who is deaf or hard of hearing unless they ask you to do so. When speaking to an individual who uses a mobility device, position yourself at eye level. Ways to accomplish this without drawing attention to yourself are kneeling, sitting in a chair, or standing a little farther away to reduce the steep angle of sightline. This is effective when interacting with all people who are sitting, as well as persons with short stature. It is okay to offer assistance. However, if the offer is not accepted, respect their preference. Do not automatically assist or touch the individual without permission. A person's wheelchair is part of their own personal space. Never move, lean on, rock, or touch their wheelchair without permission. In addition to it being rude, it can be dangerous. These are just some examples of ways you might adapt your interactions when you ask every attendee, what support do you need to receive your vaccine today? Please look at our Best Practices Guide for more tips for communication. Leading your programs with the accessibility values of autonomy, inclusion, and belonging can help bring about a better health for all people across the state. These small actions can have profound impacts on Oregonians with disabilities and access needs. Thank you for taking a moment to learn more about your accessibility kit. We look forward to hearing how it helped you have an accessible event in your community. Share your stories at uced@ohsu.edu. This video series is brought to you by Oregon Health Authority and the OHSU University Center for Excellence in Developmental Disabilities. If you want to learn more about accessibility and COVID-19, please visit us here, www.healthoregon.org/coronavirus.